Looking back, it was probably 15 years ago that it actually started affecting me. I was losing control on my right side of my body. I had lost my balance, could not ride a bicycle. I had trouble getting in and out of a car. My comprehension was gone. I could read a sentence. By the time I got to the end of the sentence, I could no more tell you what the first words were at all.
I remember the day that Mike asked if I could take the lid off a water bottle for him. I tried to do it without him seeing me react, and then I'd go in the other room and cry.
Doing well?
I'm very, very well.
I first met Mr. Harris in the emergency room. When I saw the MRI scan, I knew immediately that he would need surgery. The tumor was pressing on the brain to such an extent that it was actually shifting the brain over to the other side.
I was impressed with Stanford the minute I walked in the door. And then when she came in, it was like I was her only patient.
Any other questions for me?
She told me, you know, it's serious, but you know what, we're going to get through it.
He has what's called a meningioma, which the vast majority of the time is benign and requires just surgical resection and can be cured with surgery. I quickly assembled my team and provided surgery within the next couple of days. Operating in the brain is technically challenging for a number of reasons. The brain does not allow for any margin of error. When we do the surgery, we come in on either side and we make sure to protect this large draining vein, which is a crucial point of anatomy here, and then also all this normal brain, which is responsible for his movement and has affected his language. The surgery went extraordinarily well. He had neurologists who were there monitoring his brain waves and how his brain was talking to his arms and his legs the whole time to provide real-time feedback. We were able to resect the tumor in its entirety, and then the part of the covering of the brain, which is the dura, surrounds and protects the brain and the spinal cord. That has to be removed as part of the surgery because that's the origin of this type of tumor. Because it's a benign tumor, he doesn't require any more treatment, and he is a completely different person. Mr. Harris now is full strength. His speech has completely returned. Every time I see him, he tells me about all the new skills that he didn't even realize that he had lost during that time when he had been getting progressively sicker.
My habits, my writing had changed, and all of this just started coming back. Within 2 weeks, I'd wake up in the morning, oh, what's going to come back today? What's going to come back today? I felt like I was 10 or 15 years younger. I told Dr. Hayden one day, you have no clue what you have given me. I felt like I had a second chance at life.
His surgery was on my birthday, and I got a healthy husband for my birthday. What more could I ask for?